Hey guys, it's Ryan. This video is going to be the first of many videos, hopefully, on a series of gross anatomy videos to help prepare you for the dental board exam. So this first one's going to cover pharyngeal arches, an important topic in dentistry, and especially on the boards. They usually ask a couple questions on this. So pharyngeal arches are also called the branchial arches. Branchial meaning gill, and you can kind of see where they got that from. Here's a really cool scanning electron microscope picture 32 days into the embryo formation. They kind of look like gills, right? These little arch, this is what they're calling these arches here, kind of look like gills, I guess. So that's how they get that alternate name, branchial arches. So they're defined as a series of externally visible anterior tissue bands lying under the early brain that give rise to head and neck structures. So it makes sense they're anterior, right? The posterior side of the embryo is facing away from us. They lie under the early brain, and they're located in a position that makes sense that they'd be giving rise eventually to what will be the head and neck. You'll notice there's the first, second, third, and fourth arches here. The fifth arch actually isn't here. It's only transiently present, and it disappears during embryogenesis. And the sixth arch is here, but you can't see it because it's deep and not visible from this view. So each arch contains essentially three things. So if we took this picture, right, and we split it down the middle, we'd kind of see through, we'd see, basically if you remove the whole face of this, you'd see the posterior face from the inside. And if we took half of that back wall, you'd see an inner layer, middle layer, and an outside layer. And it's helpful to think of it in terms of inner, middle, and outer because that's how it correlates with the germ layers. If you remember endoderm, mesoderm, and ectoderm, that's exactly how they're arranged here. So each arch contains, if this is an arch here, we'll just pick this band. This is an arch. Each arch will have an endodermal pouch, mesenchymal core, which is composed of both mesoderm and neural crest, which is technically part of the ectoderm, and an external ectodermal cleft. So pouch, core, and cleft. Now, this is a slide you could probably pause, you could screenshot and study for later because this is a load of information bound to get at least one question somewhere in here. I'm just going to talk through it really quickly. Basically, there are 5 arches we have to worry about. Each arch is supplied by what will be one of the nerves, the cranial nerves, and each arch gives rise to skeletal features, muscles, and ligaments. So there's some trends here that are helpful. First arch is also called the mandibular arch, and that's helpful because it gives rise to both the mandible and gives rise to the sphenomandibular ligament. So those are some things you can keep in mind. The second arch is also called the hyoid arch, and it's an arch that gives rise to the upper half of the hyoid body. It also gives rise to the stylohyoid ligament. So things like that you can kind of work on and try to think of things to help you remember some of this stuff. But a lot of this is just going to be flashcards and rote memorization. Now let's go back to the pharyngeal clefts. This is basically our side view from before, something like this, except now it looks like we're getting the left side of that image. And we're basically going to look a little bit closer here at the pharyngeal cleft. So this is that outside ectodermal portion. So that first arch, the first pharyngeal cleft, gives rise to what will be the external auditory meatus. So the hole in your ear, essentially, right? And then the second, third, and fourth pharyngeal clefts can give rise to a cervical sinus here. It could be a lot bigger. Here it looks a little bit smaller in this picture. And basically, branchial cysts and sinuses, if they were to be formed from a second, third, or fourth pharyngeal cleft, say if they didn't close properly, you'd get these cysts or sinuses, and they'd be located laterally along the anterior border of the sternocleidomastoid muscle and are, again, remnants of these clefts if they didn't close properly. And then the pharyngeal pouches are part of this endodermal pouch layer here. And each of the arches, or each of the pouches from each arch, give rise to certain structures as well. So the first pouch gives rise to the eustachian tube and tympanic cavity, which is really convenient because we had, remember, the first cleft was the external part of the ear, and now the first pouch is the internal part of the ear. So they connect very nicely, so that makes sense. The second pouch gives rise to what will be the palatine tonsils and the fossa for the palatine tonsils. And then the third pouch gives rise to both the thymus and the inferior parathyroids, which is a little bit confusing because the fourth arch below it gives rise to the superior parathyroids and the ultimobranchial body. So these basically swap places. The superior will move up and the inferior will move down during development. So that's a little bit counterintuitive, but just memorize it that way. And just as we could have cysts and sinuses from the clefts, we can have branchial fistulas from the pouches, and they would extend from a pharyngeal pouch all the way to the surface of the neck if something went awry during development. So that's basically it, guys. Good luck studying, and I'll see you in the next video. Thanks for watching.